Welcome to you all. And Jane, may we have the apologies, please?
Yes, Chair. Apologies have been received from Councillor Cross, Councillor Toseland, who may try and attend later if she can, John Morley, Fiona Myers and Councillor Harvey.
Thank you very much. Before we go on to the record of the meeting, I just want to make a very brief announcement, please. You will, I'm sure, recall that we had agreed that one of the agenda items for tonight would be dentistry in Rutland. We are having some difficulties getting the right people to the meeting and getting the data in a timely fashion. The updated data we've got from last November, but we wanted more recent than that. And so we decided that the best thing to do would be to postpone that item until we could get all the right people in the room or in the virtual room and the right information to make it worthwhile. I have had a conversation with Councillor Ainsley, who chairs the Children's Scrutiny Panel, and clearly this is an issue for children as well as adults. And we have agreed that we will have a joint children and adult scrutiny panel meeting specifically to discuss dentistry at a date to be decided, but sooner rather than later. Paul, do you want to add anything to that?
No, that's absolutely wonderful. Thank you.
Thank you, everybody. Right, moving on then. To the record of the meeting. This is to confirm the record of the meeting of the Adult and Health Scrutiny Committee held on the 17th of February 2022. Can I have a proposer that's a correct record, please? Thank you, Rosemary. Seconder. Thank you, Paul. Those of us who were there, are we all in agreement it's a correct record? Thank you. And I presume Councillor Bull, you are abstaining. Councillor Bull is abstaining as he wasn't actually at the meeting. Thank you. Item 3, do I have any declarations of interest? It would appear not. Item 4, do we have any petitions, deputations or questions, Jane?
None received, Chair.
Thank you. And do we have item 5, questions with notice from members?
Yes, Chair. 2 questions have been received following the scrutiny pre-meet. Responses are being collated and will be sent back to the relevant members that have raised the queries. It's about agenda item 10, which is purely for information anyway.
Thank you. For the benefit of public and transparency, could we have the questions and responses attached to the minutes, please? Thank you. Item 6, were there any notices of motion from members, please?
None received, Chair.
Thank you. And is there any matter being called in?
No call-ins received, Chair.
Thank you. Right, item 8 then, access to primary care for Rutland residents. Do we have our colleagues from Lakeside Healthcare with us?
We do. I will just promote them into the meeting, Chair.
Thank you very much indeed.
Dr. Hall and Miss White, can you hear us?
Yes, I can hear you.
Lovely. Welcome to this meeting of the Rutland Scrutiny Committee, Adult and Health Scrutiny Committee. You'll appreciate that your surgery does actually serve a lot of Rutland residents, which is why we are interested in what's been going on, which you're going to explain to us in a moment. I'm going to invite you to do your presentation, and then I'll invite members of the committee plus Janet Underwood, who is not a member of this committee as such, but is representing the voice of residents in Rutland through her role as in Health Watch. But she'll explain that to you when she comes to say anything. I'm sure explain it far better than I can at the end of a long day. Dr. Hall, are you doing the presentation, or is...
I think Terry will do it. I'll just introduce myself. So I'm Dr. Sarah Hall. I've been a GP in Stamford for, this is my 30th year, actually, and I represent the Stamford surgery on the management board of Lakeside as well. And Terry's our hub manager. So she'll do the presentation, but I'm happy to take any questions later.
Thank you. Terry, just before you start, we're all in Rutland very confident that we know what a practice manager is, but could you explain for us, please, what a hub manager is?
Yeah, so can you hear me all right, by the way?
Perfectly, thank you.
Perfect, that's fine. First thing, rather than talk to myself. So obviously, as Lakeside Group, we have a combination of practice managers and hub managers. And a hub manager is a bit of a supersized practice manager. Obviously, we manage larger sites, usually more than one site as well. And it's around the sort of the management structure. And it's more of a strategic role than a practice manager, as we know of old as they were. So obviously we're just sort of moving the roles on a little bit more, as you probably see around some of the other local practices as well. So obviously we're a practice of around 29,000 patients. And we cover 2 sites. We've got the Sheep Market surgery and the St Mary's surgery as well in Stamford.
Thank you very much. Would you like to carry on and do your presentation then, please?
That's fine, yeah. Somebody sharing it for us.
I could do that, yes, just hold the line for me, Terry, and yep, I can do that. All right, let's do this. Share screen. There we go. Can everybody see that? Yep, good.
Perfect.
Got it, thank you.
So we thought we'd just give you a little bit of an update on Lakeside Stamford. We did try to just give you a bit of an update on the management structure as well. So just we haven't been able to put that screen into this, but just so you know, so we've got Dr. Sarah Hall, who is our non-executive director. So she's our lead partner within the practice, and then there's myself as the hub manager, and then the management structure underneath that is we now have a patient services manager. So they oversee sort of the reception side of things, and complaints, significant events that happen in the practice, and also looking around our policies, procedures that we enforce within the practice as well. And then we have an operations and compliance manager. She will look after, and I manage sort of the admin team, so secretarial team, dispensary as well, and then obviously the health and safety side of the practice. So anything that's operational, she'll make sure that that's all in place. And then our structure underneath that, we've also got a lead nurse, so she obviously looks after the nursing team. I will line manage her along with sort of the nursing team as well from a managerial point of view. We have salaried GPs. So with myself and Dr. Hall, we will manage the salaried GPs. Obviously my side from managerial, and again from Dr. Hall's point of view being clinical, and then obviously we've got the non-clinical teams underneath that as well. So we have a variety of sort of management support, so they're there to support us in our roles and what we do, admin, secretarial, reception, dispensary teams, and then obviously we've got the PCN team as well, alongside the neighbourhood team. So they look after sort of within the 4 counties PCN look after the sort of frailty, the care homes, that side of things, and obviously we're looking at how we can expand that as well. So it's an ever-growing team within the practice and within the PCN itself as well. Just move, thank you very much. So we've obviously recently just had our CQC inspection, as you know, at the very beginning of March. And at the moment, we still haven't had any update from CQC where we stand. We've had no report, and we don't expect to see a report until sort of mid to end April at the moment. So what we thought we'd do is just take a little bit of the information that we fed to the CQC inspectors on the day, just to give you an idea of where we are, where we were, and sort of where we're going to as well. So obviously we had a number of partner GPs retire over the last couple of years. And as you'll probably all understand and have seen in the press as well, it's really hard to recruit GPs at the moment, you know, salaried and partners. So that has had a bit of a knock-on effect with how things were at the time. So obviously a lot of partner GPs wanting to get out of that side of general practice just because of the pressures of work, the workloads that we've got, and obviously the demands that we have from patients and also from NHS England as well. We also have no management structure in place, so the practice has ran without any sort of permanent management there. We did have a transformational manager back at the beginning of 2021, and that was just a temporary contract for her, and obviously once that ended, she moved on. So I started in the practice back in September. And my background for you is that I actually worked for Lakeside Corby. So I've worked within the group for the past 5 years, and I was there as operations manager and deputy to the hub manager over in Corby as well. So I've done a lot of work in building that up over there. So obviously with myself in place, we had a patient services manager. But when I came in, looking at her skills and her knowledge, she was actually better placed within our operational team. So we interviewed her, and she obviously took on that role. And then January of this year was when our new patient services manager started with us. And again, she comes from a large practice, actually within Market Harborough. So she brought those skills and that knowledge with her. And obviously my operations manager, she's also worked in Lakeside for a number of years, plus previous primary care surgeries as well. So between us all, there's a lot of knowledge within the management side of things that we could bring that into Lakeside Stamford. We also had an issue with a lack of non-clinical staff as well. So you'll appreciate, you know, the admin team, secretarial, reception. It's just been a knock-on effect with the bad publicity that we've received, obviously going through CQC back in June and September last year. And obviously that just brings on lots of pressures within the surgery. So we had a real issue there with that as well. And obviously, as you're aware, the sort of poor patient perception that we've had around Lakeside Stamford. And lots of things obviously gone on there, and obviously that's a relationship that we're trying to build back up with our patients. We also took on a new telephone system as well, so it's something that we did across the group, something that was needed. We needed to move to a more cloud-based system, and obviously that just went in I think a week after we had our initial CQC inspection back in June. So that obviously has not helped with the patient perception, because obviously a new system in place, needed it to embed, need to see how it works. And then obviously there was just, due to the pandemic, just an increased workload as well, just limited hospital care. So obviously we were having limited access face-to-face with patients, but we're still maintaining contact with our patients as we could do via digital access, whether that be messaging, whether that be video, and obviously lots of phone calls. So obviously doing most of our consultations at that time via telephone consultation as well. Sarah, I didn't know if there's anything you wanted to add just at that bit before I move on.
No, I think that's fine, Terry. You carry on.
Lovely,
Yeah,
thank
we'll take
you.
questions after.
Thanks. If we could move to the next slide, please. So as I've already mentioned, where we are now, we've obviously just gone through our third CQC inspection. As you can appreciate, that's been a lot of hard work. The staff have been amazing, that being, the clinical staff, the GP partners, and then all the non-clinical staff as well. A lot of work has been put into that. So obviously we've got the new management structure in place. It's allowed us to bring in more non-clinical staff, so our recruitment has increased. We've been able to actually retain staff. We've also had returning staff as well that had left us previously. We've gone through partner and salaried GP recruitment as well, which is still ongoing. And we've just recently taken on, so I think we've got 3 new salaried GP started with us, and we've got a new salary GP starting with us in June as well.
Yeah, I think it's in September, Terry. It's 5.
Isn't it?
It's
it 5, is it?
Yeah,
There we are. I can't keep up with the numbers. And then obviously partner GPs as well. So Dr. Kate Tizzard joined us back in September. She was a salaried GP and has taken a partnership. We did have another partner, but unfortunately due to family circumstances, she had to move away, so it didn't work. So obviously we're still going through process for partners, but again, still that sort of barrier that we've got going on, just with GPs not wanting to take on partnerships at the moment. We've aligned a lot of our roles as well. I found when I came in that people were just sort of doing all sorts, but not anything, if you get what I mean. So sort of looked at the roles that we've got, aligned them more to their skills and their knowledge, which has helped immensely. It's been amazing. And obviously we've gone through nursing recruitment as well. We've actually have a returning AMP, advanced nurse practitioner. She comes back to us in May. She was at one of our other lakeside surgeries, but actually is asked to come back to us. And I have a new advanced nurse practitioner starting with the next couple of weeks. And then I've just got one advert out at the moment for a practice nurse. So we've managed to recruit into healthcare assistants as well. So that's really bolstered the team there. As I say, we've gone through recruitment in admin, secretaries, reception, dispensary as well. And obviously we've moved into a more safe and effective medication review process. So over the last 8 to 9 months, we've done 15,000 patient medication reviews, and obviously that's bolstered by our clinical pharmacy team as well, but majority of those have been done by our GP partners. So obviously any patients that have repeat medication, that if they've run out of issues, they are not having that issue to them until they've gone through this process. Lots of new processes within the practice anyway, clinical and non-clinical, particularly around admin and reception, just making things a lot slicker, a lot smoother, a lot easier. And we've seen how that has made a huge difference. And obviously looking at our staff communication as well across the teams. Obviously everyone still sees us as, we've got the Lakeside surgery, which is Sheep Market, and then we've got St Mary's, but we are one team and we work across both sites. And that's what we've started to do with all of our teams, is actually move them around sites so they understand, so that we can get the message out to the patients that this is Lakeside Stamford. We are one surgery, we are one team, and that's how we work. We just happen to have 2 sites. And then we've got full PPG engagement as well. So we had a sort of a bit of a rejig and a new invigorated PPG come on board with us last year, and we've been doing lots of work with them. So they're really helpful. They look at our processes. We have like a mystery shopper that helps with our telephones, so they can assess things there and give us ideas of how we can improve things. And we've also, I don't know if you realise, we've started what we call a PPG clinic. So every 2 weeks they alternate at sites and they come in so they can do Q&A sessions with the patients. So if they want to know things about the surgery, what's going on, what do the PPG do, they're there on site for us, and that seems to be working really well. And on the back of that, with the PPG, we've managed to do a patient newsletter as well, so we can try and inform the patient what's going on in the surgery and what the PPG are doing, and that seems to have we've got some good feedback on that. So yeah. So lots of things that have been going on in the past few months over at Lakeside. So I'm not sure if anyone's got any questions for us.
Thank you very much for that presentation. I can see hands going up already. So yes, we will have questions for you. Paul.
Thank you. Just fumbling around trying to find the unmute button. My goodness me, what a journey you've had. It's unbelievable, isn't it, really? We have just completed a GP task and finish group looking at GP access, and I can't help but feeling a lot of the issues that you have experienced are issues that have been experienced right across Rutland. And so I just can't help but feeling that it would be really useful if we were to try and form a collective group that actually allowed us to actually work together, because I think there's a lot of useful ideas. I love your idea of the mystery shopper. I thought that was amazing. Quite what they're going to purchase, I don't know, but there we go.
Yeah, we're just very lucky that, you know, he's very enthusiastic, got lots of ideas. He's into digital technology and all, you know, all those sorts of things as well. So we're very lucky to have him there, and it really helps us because obviously we're on the other side. So we only get from patients and ends up being complaints, but actually having somebody part of the PPG that can give us, you know, that sort of the criticism that we need, but it's constructive feedback that we can work on and we can work with the teams, has made a huge difference as well.
Yeah,
I think access obviously is a huge thing, and it's not just within Rutland, it's nationwide. Obviously, I mean, you only have to open a newspaper to see that, and I think that's for a number of reasons. I mean, number one is just the numbers of GPs available, and also the advanced nurse practitioners that play a much more increased role now in surgeries across the country. And as Terry says, we've had some great success in recruiting to that role, and also to GPs, though we still do have some vacancies. I think the other thing is the increased demand. I mean, demand is increased massively. I mean, as I say, I've been a GP for 30 years in Stamford. I've never seen anything like it in the last, 2 to 3 years. It's been incredible, and I'm sure that's based on lots of things. Obviously the pandemic had a huge impact. I think as Terry alluded to, the reduction in hospital services and early discharges, people not being able to access hospital outpatient appointments, so the only place they can go to get information or to get treatment, if their hip replacement's been delayed for a year, then they're in pain, they're requiring support, so they come to the GP, and that's only one of many situations. So we've seen massive increase of access. Obviously, mental health is a huge thing. People are very worried. People are very anxious on the back of COVID as well. So we've seen a huge increase in that area too. So as Terry said, I mean, telephone access is one thing, and our new telephone system has gone a long way to improve that. And we can also now monitor the numbers of calls. We can monitor the the range of calls that we get throughout the day. So obviously we can allocate resources in terms of receptionists to be available at those busiest times, pull in other employees. Some of the admin team will answer the phones if we see that we've got a lot of phone calls waiting. And then the other thing that we've launched actually just this last week is a new initiative, a new digital initiative. I mean, we did have a digital access called eConsult, which was good, but the new one that we've taken on is far better. We are in fact the first GP practice, Lakeside, as a GP super practice, the first one to take it on in the UK. It's a Swedish initiative, and it's used throughout Sweden, throughout I think it's Norway, Denmark, I'm not sure, many other countries. Have got 3.3 million patient contacts, so it's tried and tested, and we've taken it on as we felt that the best available digital access that there was on the market at the moment. And I'm sure, as you all know, the NHS initiative is, well, the directive is that all general practices will have at least 25% of their consultations by digital means by the end of this year. So we're ahead of the curve in that many practices will be forced into whatever the NHS England decide that access will be. But we've taken the initiative and gone for this one, which we're in the early stages because it's only been a week, but 5 of our other lakeside practices have already had a number of months of using it, and patient satisfaction ratings are in excess of 95%, which is incredible. It allows patients to kind of digitally enter their symptoms via the NHS app, and then they will have, it's almost like a live chat really with a doctor or a nurse or whoever the appropriate clinician is. It may be a pharmacist, it might be a physio. And so far in the last week, although obviously we're just working out how to embed it within our existing structure in terms of the access that we provide already, because as you can imagine, it sort of opens a floodgate really, another way in. So we're just looking at how we can manage that and how we can actually fulfill that capacity. But I mean, so far it's really promising and the patients are loving it. We've had some really good feedback. So.
Okay, thank you for that. Can I have a follow-up question?
Yeah.
Sure. Out of that conversation, and thank you, by the way, that was very open and frank, it's great. The problems that we often see, surely, is that you haven't, the age demographic means not everybody engages digitally, and a lot of people are struggling to actually absorb the new methods of engaging, in fact, actively resist the new methods of engaging. And I just wondered what, in our primary interest, of course, is that we have a significant number of Rutland patients that elect to stay at the Lakeside Stamford. And do you have any idea how many there are? I'll just off the cuff question.
What, Rutland patients?
Yeah.
You know, I'm not sure, to be honest.
It's okay. I could have looked it up, but I just never got.
Sure. I mean, we could find out. But I'm not sure off the top.
No, I wouldn't put that upon you. I think that's something we can do. But clearly, on the eastern side of the county, a lot of people choose to come across to you. So, given the age demographic, how do you intend to address the reluctance to engage? And are you using triage?
It's an interesting point, actually, because and you know, we sort of felt the same, and it's really interesting to see the age demographic of people who are actually using Doctrine, which is our digital access. I mean, I was conversing with a gentleman in his 90s on Wednesday, and it is amazing. But you're right. I mean, often it is the you know, the sort of younger or working age people, should I say, that access it. But one of the good things is, and that we're strongly reassuring, because lots of people raise that, is that we still have our other means of access. So we still have the telephone. We're still seeing people face to face. We've been seeing people face to face right through the pandemic. But the thing is, if people are using the digital access, then the people that can use the digital access, then it allows more capacity for those that can't to use the phones, because their people aren't clogging the phones up. So actually it's a positive thing for those who can't use digital or won't use digital, because the other surgeries have noticed between a 20 and 30% reduction in telephone access due to the use of the digital one. So that's only got to be a good thing for those people who prefer to access via telephone in the you know, in the older fashioned way, should I say.
Thank you.
Preferred, I think, is the better word. Preferred,
absolutely preferred. Many of us do.
I'm going to make an observation here. I'm not asking my questions. I will do that in due course. I find the NHS app impossible to use. It's just too difficult. And that's because I am sight disabled. And apps generally are quite difficult because they're not flexible. So I can't get what I want in the right format that I need. Yet I've been having phone consultations with my GP for about the last 6 years. But it's not that I'm not willing to do something different. It's that the technology is actually the barrier for me. Now, I will not be alone in that. And so I think it's really important for everybody, and that includes the Rutland County Council, to not assume that IT is the answer, because it isn't always. And we need to be cognizant of those who not are unwilling, but actually are not able to use it for whatever reason.
I think that was the point I just made to Mr. Ainsley, actually, wasn't it? That actually by allowing those that can and are willing to do it, it actually frees up capacity for those that aren't, for the more traditional methods such as the digital, such as the telephone. But I think, you know, the thing is that we are led by the NHS directive, and we have to kind of comply with what we're asked to do, and it is a national directive, and so we've got to make moves in that direction, which I think is right, but we're by no means cutting our capacity for telephone or face-to-face. In fact, our face-to-face capacity is actually ever increasing as demand requires.
Thank you. Do I have questions from other members of the panel, or from Janet, or from David for that matter? Rosemary.
Thank you, and thank you for the presentation. Obviously, a lot of work has been going on to improve things. I just wondered, are you at the right capacity now with number of GPs? And what is your next, sort of your priority really in the short term? Is it, you know, how long people have got to wait for appointments? Is it access? What's your key driver at the moment? Thank you.
We're not at capacity of GPs. You know, we need, you know, we'd like more partners, we'd like more salaried, you know, but it's looking at the workforce, as you say there, for what is the demand, where does that need to be? Now, again, in a traditional GP surgery, it's always that you need lots of GPs on site, and they're the people that see the patients. However, we know that that's changing, and that's why we're looking at things like advanced nurse practitioners. You know, you're looking at you know, your ECPs, your emergency community practitioners, so that you've got a visiting team set up for those patients that need it. They shouldn't necessarily be a GP that needs to see patients. So obviously, you know, we're always looking at our workforce, we're looking at our capacity. I mean, that's work that we're doing at the moment, just to see where we can fulfill, and actually using this new technology with doctoring actually gives us a better analysis of what the patients want, who is it they need to see. So we get that on a daily basis. It's a rolling data analysis that goes on as those consultations come through. So that's going to really help us plan out what is it that we need and where is the best fit for those as well.
Thank you. Do you have a follow-up, Rosemary?
No, not specifically, no. Thank you.
I would just simply make an observation to that. We are used in Rutland to having senior nurse practitioners and going to them, or physiotherapists employed by our GP practice. There was initially an awful lot of resistance within our residents. There is still resistance, not as much as there was, but it's still there. And I think it's incumbent on you, and it was incumbent on our practices that are physically in Rutland, to explain to patients that actually you're not getting a second-class service if you don't get a doctor. Apologies, Dr. Hall, I'm not trying to talk down doctors. I'm trying to talk up your...
I totally agree with you.
And I do think it's important. And I've had conversations with residents who feel they must see the GP, when actually the GP may not even be the best person for them.
Absolutely. I mean, if I had diabetes, I'd rather see our diabetic specialist nurse than me. If I had asthma, I'd rather see our specialist respiratory nurse than me, because that's what they do, you know, the majority of their time. And so they're, you know, that they're clued up, they've got far more expertise. I'd rather see our musculoskeletal specialist physio if I had a bad back. You know, I'd rather speak to our clinical pharmacist if I had a query with my medication. It's actually letting people understand that. And I think through our work with the PPG and through our newsletter, we're actually kind of showcasing different members of our team and explaining what they do and what their roles are. So we're trying to get you know, the information out there. But as you say, you know, change is difficult, and a lot of people, particularly around healthcare, don't want change. And I can understand that. I say I've been in general practice for 30 years, so I've seen a lot of change. And you know, I liked the traditional model that I first started working in, but you know, it's like with anything, you know, things move on and we have to change and we have to adapt to what's available, and there just aren't enough GPs available, so we've got to move to these new working models. And I totally agree with you, they are not second class.
Thank you. June, Ken, have either of you got any questions? June's shaken her head.
The chairman, I've come off of stream because my signal's going in. No, Rosemary has asked the exact questions that I was going to ask. Thank you.
Thank you. Well, as all the members of the panel have asked their questions, I will now turn to Councillor David Wilby. David is our Cabinet Member for Children's Services, but he is a councillor on the east side of Rutland and on northeast, and as a result has many residents in his ward who actually attend your practice. David.
Thank you very much, Chair. Dr. Hall, if I may just add an unbiased comment from the touchline. I've been a member of the Lakeside surgery now for nearly 25 years, and I've had a heart condition for probably about 10 of those years, and I've only seen a doctor in the surgery probably about 5 times, but I have had extremely good health all the way through. I've had extremely good nurses. I use the dispensary every month to keep me alive, and they are jolly good. I know that over the last 2 years there have been all sorts of problems muted about the surgeries and things like that, but every time you've needed to rise to the occasion for inoculations or vaccinations or anything like that, the system has worked absolutely perfectly, and you should be very proud of that. So all I would like to say to you is that the team that you have both in the dispensary and on the front desk have always been extremely kind and helpful to me, and I thank you very much.
Thank you for that. We'll feedback. We'll definitely feed that back to the teams because it's much appreciated. Because they do have a difficult time, and again, it's not just in Stamford. It's nationwide. That particularly the receptionists and those on the front line, unfortunately, sadly, do get a lot of abuse. You know, it's something that, again, in 30 years, I've never experienced until the last few years, and it's not acceptable. So when we get positive comments, we always like to share them, and in fact we've got a board with little cards on, haven't we, that patients write their thank yous, and we get lots and lots of those. I think the thank yous do far outweigh the complaints, but it's just the complaints shout louder.
Janet, I'll bring you in now. Would you like to properly explain your role and then ask your question or make your comments as appropriate?
Thank you, Chair. Yes, I'm Janet Underwood and I'm the Chair of Health Watch Rutland. I've been the Chair for just over 3 years now, so we've been following the sorry saga of the fortunes of Lakeside over the last 3 years quite closely, and obviously been hearing a lot from Rutland residents about the problems that you've had. From your presentation, it seems that you've turned a corner, and I'm pleased to hear that. Haven't heard anything recently from patients, but what I have heard is that a lot of patients have left you and migrated to Empingham practice. So what I'm wondering is, have you got less patients now than you did have, and has this contributed towards the improvements that you're bringing about? There's less pressure on you.
Oh, sorry. No, you've got another question.
I've got several, sorry. My second question is that my understanding was, and I might be wrong because this has come from patients who were a bit confused by all the changes that were going on, that the St Mary's site was being used just for COVID and administration, and the Sheepside one is being used for general practice. Is that so, and is that still happening? And my third question is the digital program that that's come from Sweden. I wonder if you could tell me the name.
Yeah, Doctrine. Doctrin.
All right.
Doctrine.
It sounds really interesting.
It is, yeah.
And I'm wondering if this is something that could be fed back into Rutland. I'm not sure. You know, I can't tell surgeries how to run their practices.
No, I think we're the pilot for the UK, and obviously, I mean, it's a company. It's a, you know, it's a sort of private digital company that is actually owned and run by doctors and was developed by doctors in Sweden, and obviously they are very keen to enter the UK market, and we're the pilot for them. And I think there's been a lot of interest. Actually, Dr. Langdon, who's one of our partners, was down in London last week, actually presenting it to NHS England. So I think there's quite a lot of interest in it. But I mean, when it'll become available to other practices, I'm not sure. I think they want to make sure and embed it, because obviously the culture's different here than it is in Sweden, and they just want to make sure that it's working well in our practices, I think, before. But you know, I think the hope is that they will release it nationwide. Yeah.
And the number of patients.
Sorry?
And the number of patients that you now have.
Yes. So to go back to your first question, yeah, we have we've lost about 1,000 patients, I'd say, overall over the last 12-18 months, and I know quite a lot of them have gone to Empingham, some have gone to Wansford. I think, people do have obviously have got a right to register with a GP wherever they choose to, and I think, yes, the issues that we were having must have impacted that. I think then the very negative CQC report that we received last June obviously had an impact as well. Interestingly, we are getting a few people coming back now, because I think they realise the grass is not necessarily always greener, although, our local surgeries in Empingham and Wansford are excellent as well. But as to whether that's had any impact on the improvements, I don't think significantly, because we've still got 29,000 patients. So it hasn't. I think the impact on the improvements has been the tremendous amount of work that we've all put in as a team. Completely overhauled virtually every system within the practice. I mean, what Terry's touched on is just a kind of an overview of what's gone on, but it has been an incredible amount of work that's been put in. I mean, obviously, the less patients we have, then access is going to improve. If we'd got half as many patients, it'd be fantastic. But that's not the case, in terms of, not fantastic in many ways, but obviously for patients accessing it would be. So I don't think it's had a huge impact. It may have had a little impact, but not massive. Sorry, I can't remember what your other question was. There was another one.
It was about the two sites. When I saw.
Oh yeah. Again, this is a sort of old chestnut that keeps raising its head, and I think it's just people have just not kind of fully understood that when the first COVID vaccination started, so that was not last Christmas, it was the Christmas before, we decided to close St Mary's Centre as an acute site and use that purely for vaccinations, because we knew we had a massive task, and we did 20,000 plus vaccinations just, kind of within our team, which was incredible. So we used that site so that we could keep it, clear. We could have a good flow. We had the right amounts of room and everything, and the right systems in place. But pretty soon after that, actually, as soon as that first kind of wave had settled down a bit and things started to open up, we reopened St Mary's Medical Centre, and it's been open ever since, exactly the same. It's like it's equivalent to a branch surgery that many practices have, really. That the main and larger site is the sheep market, and all the acute stuff, so the emergency stuff, the same day sort of urgent stuff would happen at the sheep market. But there's nurses, there's GPs, there's physios, there's a dispensary, there's everything else goes on at St Mary's as well.
Thank you.
And we've no intention to change that in the near future.
And have things settled down with the lease of St Mary's now?
Yes, yeah, the lease has been taken over by LCHS.
Thank you.
Anything else, Janet?
No, that's all. Thank you.
Thank you. Rosemary.
May I come back with another question? It was one I was sort of going to ask before, but I think it probably follows on from what Janet said. In terms of patients who have left, having seen your CQC reports and having got very frustrated, in terms of them coming back, what would you say to them that has improved? What sort of practice will they see now if they come back? And also, is there anything else, any other messages that you think is useful for us as councillors to get out to residents? So those two really. What would entice them back, and what will they see that's different from the improvements that you've made?
Do you want to answer, Terry, or do you want me to?
That's quite a hard one, really, isn't it? Because it's about patient choice at the end of the
Yeah.
day. We all have a choice of where we register within our locality, and it's preference. You know, I can't comment on Empingham or Wansford of how they manage their practice and what services they deliver. But from a Lakeside point of view, the whole point of us being a super practice as Lakeside Group, what we can bring are the additional services. So being a very large partnership, it means that we all pull together, that we are able to have better services. So we talked about musculoskeletal physiotherapists. Now that's somebody that we employ at the practice. Now alongside our PCN, and obviously our PCN is ourselves and the Heraldwood practice. Again, that bolsters the types of services that we can bring. So as I talked about sort of the frailty, the care homes, the feedback that we get from the care homes is exemplary. The work that's been done there. We're again being a bigger practice, we can bring in clinical pharmacists, pharmacy technicians. We have then group leads that actually can come in and supervise and bring in additional help there as well. And I think they just see the services that we are bringing into the practice. We're on a bigger scale than those small practices, so I think that's just more that we can bring in.
I think a lot of the changes are behind the scenes and people wouldn't necessarily appreciate and wouldn't be aware of. And I think, the main thing, I think patients have never sort of complained or criticised about the care that they get in terms of the clinical care. We've always had very positive feedback about that, which is obviously great. It's always been the access, and to be honest, it's always been like that for years, never as bad as it is now, but for many, many years, we've always done patient surveys every year, and the two things that come out top is access to appointments and car parking. It's always the same, and every single year. And so I think we don't have the same criticisms about car parking now, because there's not quite as many people coming in face to face, so obviously the digital and the telephone access has reduced that, so we don't really get a complaint about that, but access has always been the key. And I think we have improved things. We've improved things with our telephone system. We've improved waiting times on the telephone. As I say, these new digital initiatives will they've started to improve things, but we're only a week in. But I think that will make a dramatic improvement, not only in terms of digital access, but also in terms of telephone access. The things that Terry was saying, the wide range of variety of practitioners that I know many sort of larger surgeries have, and even some of the smaller ones now have. So I think there are many, many changes, really, but I don't. Solving the access issue is a difficult one, and I say we're not alone in that. It's across the whole country, but we're not. We're going to keep trying. We're going to keep improving, and we're determined to do that. But as Terry says, we're not in the business of enticing patients. If we're delighted if patients want to come back and join us, that's fantastic, and they would always be welcome. As long as they're not the trouble causers and the ones that abuse, we're quite glad to see the back of those. But they're always welcome. But it's patient choice, and that's right. So patients have got a right to choose where they access their healthcare.
Thank you, Janet.
Thank you. This isn't just specific to Lakeside. One of the big problems that we have been consistently hearing about is the misunderstanding of care navigators, who formerly the receptionists. The general public are very concerned that they are being signposted to different professionals who the patients think are the wrong professionals, but the care navigators think are the right professionals. And I'm just wondering if you're having this problem with your patients in much the same way as the Rutland surgeries are, and how you're hoping to overcome that or planning to overcome that resistance to actually having to give your often intimate details of your problems to somebody who is perceived as untrained and possibly unsupervised.
And again, that's always been the case. I mean, I've worked in primary care for 20 odd years myself now as well, so you know, I've been there on the desk, and you know, I'm now sort of back from that, but it's always been the same thing. And it's about, I think what patients forget is actually this is a practice decision about how the patient should be navigated and should be signposted, and it isn't just them, you know, battle axe, receptionist won't let me see, will want to see, and what have you. It's about being able to signpost and educate the patients to where they're going to get the best, you know, care from. And we talked about this before, Dr. Hall saying, you know, if you want problem with your diabetes, you want to go and see a diabetes specialist, and that's what we're trying to do. So I think in line with our PPG and the way that they're on board with us, part of our newsletter, part of our PPG clinic is about the education to patients about what services we provide and where we can signpost them to get the best help and care that they need. You know, we're just signed up to the community pharmacy referral system. And that means that if the patients feel they're not getting what they need, you know, sort of just an over the counter, they can come into us, and our reception team, our care navigators, can actually sign them more appropriately to a better pharmacist to deal with those, rather than just seeing, you know, your pharmacy assistant that you'd see in the community pharmacy to get that help. So there's lots of different avenues that are opening up for everybody now, and it is about the patient education. And I think very much for us, it's around that help from the PPG to do that, to educate them.
Thank you. Yes, I am audible. Thank you very much. I have a couple of points. Rosemary, in fact, has asked most of the questions I was going to ask, so thank you, Rosemary. First of all, I'd like to commend to you the second report that we have got on our agenda tonight, and that is our Task and Finish Group's review of GP practices in Rutland. It's a very thorough report, and I'm sure if you didn't get the full agenda papers, Jane will make sure that you do get a copy of it. Is that okay, Jane? Yes, she's nodding, that's okay. Because whilst it's practice specific in some respects, a lot of what's in it is common to all practices everywhere. And there are some suggestions, well, a number of them actually, recommendations within the report, which you may find are helpful for you that you had not necessarily thought about. Certainly when I read it, and I've been working in this field forever, well, it feels like forever, there were things in it that I wouldn't have thought about. So I would commend that you read it. It's not specific to you, but it will resonate, I'm sure, in places. So that's the first thing I want to say. The second thing I want to say is that I would like to thank you both for your time tonight. I appreciate time is the most valuable commodity we've all got. So thank you for coming. You do understand, though, why we asked you to come, because we are here to represent the interests of our residents, and many of them are with you. I am not going to embarrass you by asking you what you think your most recent CQC inspection result is likely to be, not least because I know you wouldn't be allowed to tell me anyway, any informal feedback that you've got. I'm perfectly well aware of that. But I would like to reserve the right to ask you to come and talk about it once it is published, if we feel that we need to ask you to come and talk about it, if that makes sense to you. Clearly, if it's all, this practice is now brilliant, then we won't waste your time. But if it's not, we are going to need to know what you're doing. I have to say, having said that, clearly your tackling of the management issues is crucial to improvement. If you don't get your systems and structures right as an organisation, then your end user, your patients, are not going to see any difference. So I like to commend you for the way you've approached that. And I'm sure, as colleagues have said, that is going to make a huge difference. But my final question, having said all of that, is I would have liked somebody from your patient participation group to be here tonight to talk about the patient experience. But I wonder if you could say, when do you think you will get to the point where your patients are as content as they can be? And we know there are always people who will not be content, whatever you do. In other words, when do you think you'll be at the end of this journey you are on?
Well, that's a loaded question, really, isn't it? You know, we have seen, you know, in the past sort of, you know, where are we? 4 months or so, our complaints have dropped dramatically. And that's from whether the complaints that we've had through directly to ourselves via the CCG, Cqc and Health Watch as well, they have dramatically dropped. So I think that just shows that actually patients are recognising the changes, you know, and they are becoming more content, as you put it. I think that's definitely, you know, there is that communication more with the team, the management team, our patient services manager, you know, if she's on site and not in meetings or, you know, her other work, she's able to contact those patients that may have a grumble or, you know, anything, that she can contact them and actually speak to them there and then. And often all our patients want is somebody to talk to. You know, just to get things off their chest and just to speak about that. So that's made a huge difference to us. And obviously we report on that on a monthly basis within our partner business meeting. And we do see that we have dramatically dropped around our complaints. So I'm hoping we're on the right path. I'm hoping that our CQC report goes along the same lines as well. As I said at the beginning, we haven't, you know, we have no indication really of what that outcome will be, and we, you know, we're still waiting on the sort of the draft report as well, but unfortunately our lead inspector is on annual leave, so we're in the hands of CQC at the moment. But it just means for us that we continue as we've already been doing, that we continue with those improvements that we've started to make, and to embed those into the practice, and to make sure that we've got a harmonious team as well, because that makes for, you know, harmonious team makes for a more harmonious patient population as well. And I think that is showing with our patients.
Thank you. I feel for you with your senior inspector being on annual leave. I have to say that when I worked in this area, I worked for the Audit Commission, we made certain that anyone we were inspecting or auditing wouldn't be in the position of having to wait an inordinate length of time because somebody wasn't available. We fixed leave accordingly. So I think that's rotten hard luck, and I'm really sorry for you over that.
Yeah, we're very frustrated about that actually, because obviously we're waiting for that report, as are our team and our patients. So it is very frustrating.
I think if I, off the record, which is impossible when you're in a public place, I think if I was you, I'd be inclined to put a complaint into the CQC about it. But
I think we'll wait till we get the report. And then
okay.
I think you might be right.
We have been joined by Councillor Tizzard, who unfortunately couldn't be with us at the beginning of the meeting, and so hasn't had the opportunity to hear what you've had to say, but I did ensure that your slides were circulated in advance. Leah, is there anything you'd like to ask?
Thank you, Councillor Waller. I did have a question. Sorry for my lateness to the meeting. I have 2 young children who are both autistic, and my eldest actually had quite a severe meltdown, which is why I was late. But my question was, because I have young children, I am interested to know what your plans are for the future with your surgery. especially in terms of the children and in terms of what your plans are for accessibility as well, if you'd be happy
I think we've spent a lot of time talking about that already, so it might be something just to maybe feedback with your colleagues, because I think most of our kind of talk already has been about that. I mean, I can briefly summarise in that, you know, children, particularly unwell children, acutely unwell children, are always given a priority and will always be put on the list for the same day doctor. So, I mean, that's always and will continue to be a priority. We just mentioned that in the last week we've launched a new digital access system, which we are anticipating will hugely improve access, particularly obviously for those people who are happy and comfortable to use digital access. For those that aren't able to do that, and just to summarise, it's far more advanced than any other digital access systems that we've used and that majority of people are using in the UK at the moment. It comes from Sweden, and it's an interactive conversation digitally with a GP or advanced practice nurse or physio, whoever the professional is that you need to speak to. So I think that really will be a game changer. I think also, as we mentioned, that for those that aren't able to use that or don't choose to use that, the fact that many people are using it will actually release capacity on the telephone, so access will be improved in that way. So there's many, many changes that we are making, that we've made already, that we will continue to press on with to improve access.
Thank you. Anything else you'd like to ask, Leah?
Would it be possible to be sent a link to read some more information on your digital access?
Yeah, we did get
just sound
details. So it's called Doctrine, DOCTRIN. So if you Google that, you'll find there's quite a lot of information. We're the only Lakeside surgery practice are the only ones in the UK at the moment, because it's sort of first UK launch. So you won't find a lot else in the UK other than our experience of it. But 5 of our sites, we're the 6th sites to go live with it. And the experience has been very positive. I said to your colleagues earlier, it's, I think, in excess of 95% patient satisfaction, which is unheard of in healthcare feedback. So
anything else, Leah?
No, that's it. Thank you.
Thank you. Following on from Leah's question, actually, not so much children now, but children in 10 or 15 years' time, when they're grown up and adults and are having children of their own, they are going to be part of an increasing population, on top of which there are a lot of plans for increasing housing around Stamford. Are you, as a practice actively engaged with South Custodian District Council, or the planning authority, in order that you will be thinking about the future and meeting future need?
We're not currently, no. I mean, it's actually the responsibility of the CCG to provide general practice services currently. So that they will be engaging, and obviously we are engaging closely with them as well. But I mean, at the current time, as we've spent the whole evening discussing so far, we you know, the access is difficult for the patients that we have. So actually absorbing however many thousands of new patients that are coming to Stamford is actually going to be impossible for us at the moment, the way that we are. So the CCG will have to come up with some creative solutions for that.
Thank you. I found that answer very illuminating. Thank you, in a variety of ways. If nobody has anything else pressing, once again, Dr. Hall and Terry, I'd like to thank you for coming, for your candour as much as anything else. It was very much appreciated. Thank you. And if you'd like to go,
thank you.
Free. If you want to watch the rest, please feel free to do that as well.
That's all right. Thank you very much. Nice to meet you all.
Thank you.
Thank you.
Bye.
Thank you.
Bye-bye. Thank you, everybody. Nobody said they wanted to make any recommendations. I think the only recommendation that we need to confirm is that pending the outcome of the CQC report that the practice had in late February, early March, that we reserve the right to invite them back again. Paul?
Thank you. Yeah, it's not so much a recommendation. I'd really like to see the Rutland PPGs put in touch with the Lakeside PPGs. I think that would be a really useful exercise. So I don't know whether when we send a presentation to them, we can ask that question at the same time, so we can get the necessary information. I think that would be, they seem to be doing some really sterling stuff, which I think might be useful to be shared.
I wonder whether we might add that to the recommendations that we make on the next item.
I'm not bothered either way. I'm just keen to move forward the collaboration between Lakeside PPG and the Rutland PPGs.
Yeah, no. I don't disagree with you. I'm simply thinking of the process here. Are we all in a, can I have a seconder to my proposal that we are reserving the right to invite them back again, please? Thank you, Ken.
I'll second.
Thanks. Are we all in favour of that? So we do actually have a, yeah, that's unanimous. Thank you. Okay, moving on then to item number 9, the Primary Care Task and Finish Group final report. Paul, can I ask you to introduce this, please?
Yes, of course. In the first instance, I think I'd like to provide some context to the report. In order for the final report to be fed into the new integrated care plan, there was an urgency to better understand the issues raised by GP access and the wider contribution that the council can play in feeding into that care plan. It was also resolved at full council the group submit its final report to Adults and Health for endorsement and approval, which actually forced quite a series of tight deadlines, particularly as we also were needed to deliver an interim report with provisional findings and recommendations in early 22, so as to feed into the Rutland place-led plan. These were significant constraints, and following the establishment of the Primary Care Task and Finish Group on the 11th of October, there were 72 working days to produce both the interim and final reports, with a deadline for the final report to be completed, well, by today. To further compound the pressures, it should be noted that 2 members left the group during the development period, although we did welcome Leah onto our team. I'm really hoping that the review of the Constitution and the place of scrutiny, coupled with the establishment and task and finish groups, will be reviewed so that these unnecessary pressures are not brought to bear in future on what is, I believe, useful and necessary work. So that's what I felt was the context. In other words, we're working damn hard to actually produce stuff in time. Moving on to recommendations, I don't intend to dwell on the recommendations made in section 8, hoping that you've all had a chance to read them, but do want to point out that it was never the intention of the group to dictate which parts of the organisation should be improved and by whom. We felt that was better left to the professionals, so we're just making recommendations. And we also recommended to council the second survey be carried out in January 2023, and we chose that date deliberately because we felt that when the necessary groups were following the recommendations and improvements that needed time to bed in to have the necessary effect on the actual services provided. Last and finally, I really do want to take this opportunity to thank the hardworking members of the group and for the unstinting support by officers, Jane, and others in producing this final report. So tight were deadlines that towards the latter stages of producing the report, the group were meeting twice a week as the deadline for the 16th of March loomed closer. So without further ado, I'd like to commend this report to the Scrutiny Committee and welcome any questions or observations. Thank you.
Thank you, Paul. We did consider the draft version of this report without recommendations, obviously, a little while ago. So we have spent some time discussing this. But are there any observations or indeed questions of Paul, who was the sponsor for this task and finish group?
Sorry. Yeah.
No, I see no hands. Well, I have a slight concern about one of the recommendations, in that we are asking Rutland County Council to put resource into the GP practices. Firstly, I'm not sure Rutland County Council has the resource to put it in the first place. And secondly, I'm not sure it is appropriate, given that we are not the commissioners of the services in the first place. And I have circulated to all of you which one that is and what I'm proposing doing about it, apart from Janet, who's not a member of the group. I will read it all out in a minute, Janet. But apart from that, I did feel that this committee needs to be a little bit more direct in what it is recommending, hence what I circulated to you. So I will read out what I think we need to do to enable all this hard work, and there was enormous amount of hard work went into this, but that it has best effect. And that is, this committee, 1, endorses the report of the Primary Care Task and Finish Group and its recommendations in section 8, save that in 8.1e, the references to public health and RCC are omitted. I would like, in light of what Paul said a few minutes ago on the previous item, to also add in there and add in 4, that is a recommendation 4 within the 8.1, so it'd be 8.4, wouldn't it? I've done this quickly on the hoof, Jane, so I haven't got it quite right, but I'm trusting that you will. And it's that the PPGs make contact with Lakeside PPG in order to share good practice for the best interests of Rutland residents. Does that summarise what you wanted, Paul?
Sorry, yes, it does.
Thank you. So I'll add that in. And then I've got 2, requests council approve the amended report and commends it to LLR CCG, Lincolnshire CCG, RCC's Health and Wellbeing Board, each Rutland GP practice and their PPGs, with a request that the recommendations in section 8 be actioned by the appropriate body. And 3, determines that the scrutiny process in Rutland will follow up this work with a further public survey. I'd said 6 months after our discussions earlier this week. I think that had better be January 2023, in light of what Paul said tonight. So a further public survey in January 2023 to gauge public satisfaction with improvement in the key areas identified.
Could I just make one small point on that last one, girl? It's carried out by January, not in January 2023.
Yep, fine, bye.
Thank you.
All right, would you like me to read all that through again from the beginning?
Leah?
Leah?
Could you just read 1 again for me?
Yes.
Sorry, thank you.
No, it's fine. Endorses the report of the Primary Care Task and Finish Group and its recommendations in section 8, save that in 8.1.e, the references to public health and RCC are omitted, and add in 8.4 that the PPGs make contact with Lakeside PPG in order to share good practice for the best interests of Rutland residents. Are we happy with everything else? Jane, are you happy you've got those amendments? Great, fantastic. Do I have a seconder, please? Thank you, June. All those in favour, please.
Gail, I'm not certain whether I should vote on this or not. Do I not have an
Oh,
interest?
please do. There isn't any reason why you shouldn't.
Really? Okay.
In which case it's unanimous. Thank you. Janet wants to say something. Technically, as we have now passed the recommendation for this report, you can't, but as we are earlier than we have sometimes been, I will indulge you this time.
Thank you, and apologies. It's just come to my mind. I noticed in the report the estate problems, that they're sort of at capacity and beyond. And I really just, and I also noticed that you've noted that only Empingham has been highlighted by the CCG as being in need of improvements at this moment in time. And I just really wanted to highlight that, because I think all of our practices need help with their estates.
May I come back on that?
Of course, Paul.
I absolutely 100% concur with that. And I also, and as a second to that, I'm also slightly concerned because I have today received the Oakham surgery practice report, which was a huge surprise. But in there, they're saying that they're not expecting, but they would prefer to have 106 money. So I think there's lots of issues to actually be thrashed out here. And I think you're absolutely correct. Every surgery seems to have either, well, both, doesn't it? It has capacity. By that, I mean that lack of people to staff it, and also capacity issues, that they tend to be too small for what they need to do, particularly with a new way of working. So there we go.
Can I ask you to hold that thought for the moment? I will close item 9, but I will come back to that thought under item 11. Item 10 is for information only. The reason we have it for information only was that when we were planning this, we thought we would have dentistry as well. And I did feel that you would like to finish the meeting in March and not go into April. And so I thought it would just make it too long a meeting for everybody. Clearly, we can't ignore the performance data. But if you've got any specific questions or observations, please send them into Jane, who will make sure they get properly answered and the answers attached to the minutes. If when you've had the answers, you feel there is an area that we need to look at particularly, if you come to that conclusion before annual council, let me know, and I will do my best to make sure that it is appropriately dealt with. I'm not sure how, but something will happen and I will get back to you on it. So that's item 10. Then review of the forward plan and annual work plan. So coming back to your thoughts about GP estate, clearly this is the last meeting in the municipal year of this scrutiny committee, and Rutland County Council is reviewing how we do scrutiny in future, so we may not have this committee going forward. We will, however, still be scrutinising adults and health in some guise. Would you be content for me to put as a potential scrutiny item GP practice estate?
Ooh.
Well, in theory, the reason I'm asking is, in theory, it is the responsibility of the CCG, or presumably ICS going forward, to make sure that the estate is sufficient. However, we as a council are a planning authority, and in that guise, we can encourage developers for our larger estates to actually build facilities. We can certainly use Section 106 money to help with new facilities, which is precisely what we did at Empingham. So it's not outside our remit to do something. What we cannot do is commission more GPs or a GP practice, but it is something that we could review as to whether our estate, the actual physical part of the practices, is fit for purpose now and will be fit for purpose in the future. Ken?
Yes, no, Madam Chairman, I'm very supportive of that, because if we consider the concerns across the board with our surgeries and with health and getting appointments and whatever, I think we do need don't like the word pressure, but we really do need, I think, very much a watching brief on this to really make sure that these improvements come through. So I think it's purely from anything that we can do, we should. And this is probably another vehicle, but I think we should use it.
Any other views from anyone? That includes Janet. June.
Yeah, I understand the concern on estate in the fact that traditionally people have liked to go along to their surgery to see a doctor. However, since we've been in COVID for 2 years now, a lot of the appointments now are actually online or telephone appointments. So I'm just wondering whether this problem with estates might actually go away because there are more doctors actually doing online appointments rather than actually physically on site.
That is a very, very valid view, clearly. But of course, it's something that if we were to do a review would be explored within it. I saw Paul first, then Ken, then Janet, but that might not be the right order, but that was the order I saw you in. Paul.
Thank you. I was just really responding to June's point. It's highly possible that it may reduce estate pressures, but it's also highly likely given the use of other professionals. I know one of the things we did pick up very frequently was that there wasn't enough room for all the other professionals, you know, the specialists to be housed within the current estate. And the other thing that crossed my mind was that we have done a review of our estate. That's Rutland County Council's buildings, hasn't we, in estates? And I just wondered whether that actually may be useful to feed into, particularly if we look to get rid of some of our premises or make better use of our premises, feed into that report as well.
Thank you. Ken.
It was only just really coming back as a comment. I agree with June in as much as there's a lot more of these telephone appointments, but there was quite a feature in the press over, yes, you can get through more appointments, but there was this quite a strong article saying, unfortunately, there are a number of conditions which are being missed. And I had the opportunity the other day to talk to a very eminent specialist in Leicestershire. And he was just going through the basics, you know, it's how you walk into the surgery. It's how you can look at the color of your skin, the whiteness of your eyes, which is not readily available in this sort of Zoom profile that we have. So I'm not disagreeing with what June is saying, but I'm just saying I'm not sure that more consultations by Zoom or telephone even are the answer going forward. You know, I think they're saying we're going to have a hell of a problem with cancer being missed in in thousands of people because of COVID. And that's not a criticism of the health service, it's a fact. But I do think we really have to think very carefully about this one.
Thank you.
Thank you.
Janet.
Thank you. You probably know, and I'm probably teaching you how to suck eggs, but the CCG have been formulating an estate strategy, and there have been several papers out. The person that's been, I think, heading it up is Sarah Creamer, who you probably know. And that is where I suspect that you've got the data to suggest that Empingham is the only surgery that needs any sort of enlargement in Rutland. So rather than, well, to avoid duplication, I would suggest that you have some contact with Sarah and the papers that they've actually formulated.
Thank you, Janet. I think if we agree that we want to include this as a potential work programme item in the new municipal year, that actually gathering evidence from the CCG first would be the starting point for it anyway. And then we have to balance that against the views of our residents that Paul and his group have come back with quite clearly. I don't know, over to you. Do we want to put it down as a potential item? Does silence signify disagreement or agreement in this context?
Well, I'm happy, if you're proposing it, Madam Chairman, I'm happy to second it. Perhaps we can just take a sounding from the committee.
All in favour of that? I mean, it won't necessarily happen because we all are under time constraints and so on. It's just there as an item of possible further exploration. All in favour? Oh, well, that's unanimous. That's fine. We'll put it down. Is there anything else that you feel we need to be putting on the forward plan for next year? I have had initial discussions with the director about looking at something on the adult social care side. As you know, there is great turmoil and change in adult social care. So I suspect there is something extremely useful we could do going forward. Precisely what at this moment in time, I can't say, but those discussions are ongoing, and clearly there won't be any decisions made until after annual council anyway, but that's just for your information. If there's anything specific you think we should be looking at, again, I'd be very grateful to hear them by email or a phone call or speaking to me when you see me in person. Anything else within adult care? June?
Can I just say before we move on that I'd really like to thank the Task and Finish group for all the work that they actually did in a very short period of time. I don't think anybody's actually said that, but they worked extremely hard, and I personally would like to thank them.
I thought I had. If
I missed it, Gail, sorry.
if it didn't come across as that when I was commending their work in my introduction, then I apologise. I did mean to thank them, and if I didn't quite say it, then I'm sorry for that. I think they did an absolutely outstanding job, and I'm sure I said that, didn't I, Paul?
No.
Oh, I thought I had. Well, I do think they did an outstanding job.
I do think that the team worked exceptionally hard, and it was tiresome at times, I have to say. Not working with the team, but actually pulling the information out from the various groups. So thank you for your kind comments, and I'll pass it along. I'm sure Leah will pass it along, won't you, Leah?
Yeah.
Thank you.
I'm sure Jane will put appropriate words in the minutes so the whole world can see how appreciative we were.
Good. Okay, this is sycophantic now. I'm going to have to leave the meeting.
Right. I'm going to move it on. We don't have a future meeting. Oh no, I skipped one. Sorry. I have not been notified of any other urgent business. Item 12 and item 13. We don't have another meeting scheduled, and I suspect one way or another in this format we won't have another meeting because of our review of scrutiny. I don't know what it's going to look like, but I think there is a strong push for it not to be more of the same in a structural sense. But we will see, we will see. But all that will be decided, I presume, before annual council. Otherwise, hopefully it will be the same, more of the same. So thank you all for your time, and I declare this meeting closed at 8:29.
Thank you, Gail. Very good.
You, Gail.
Excellent.
And thank you all for your work during the course of this year, and most particularly since I took over the chair. Thank you.
Thank you. Bye.
Thank you.
Good night. Good night.
Bye.
Thank you, Jane. You're on mute, Jane.
Story of my life. No, I thought Lakeside did very good. They were excellent. Yeah.
Very clear presentation.
Yes.
But it'll be interesting to see what the CQC say, because I read the earlier report, and it's a long time since I've read anything quite that damning.
I think they were very brave coming here. I think they were answered truthfully. I think they answered with integrity, and I think they were come up with some damn good ideas, actually. So
Yes.